Ottawa ankle rules. An x-ray is indicated after an acute injury if there is pain in any of the following: inability to bear weight for 4 steps immediately after injury or an emergency department, bone tenderness in any of the following locations: posterior edge of the distal 6 centimeters of the fibula or the tip of the lateral malleolus, posterior edge of the distal 6 centimeters of the tibia or the tip of the medial malleolus. For foot injuries, the base of the 5th metatarsal and the navicular bone. The test item cluster for patients likely to benefit from spinal stabilization exercises includes age less than 40 years old, average straight leg raise greater than 91 degrees, aberrant motion, which includes an instability catch, painful motion, pseudo-Gower sign, or reverse lumbopelvic rhythm, and the final one is a positive Cronin stability test, which I will show you now. So first you want to check in resting. Let me know if you have any pain. And then you want to have her lift her legs and check for pain. The test item cluster for patients likely to benefit from spinal manipulation include symptom duration less than or equal to 16 days, no symptoms distal to knee, an FABQ work subscale score of less than 19, at least 1 hypomobile lumbar segment, and hip internal rotation of greater than 35 degrees and at least 1 hip. The McMurray's test is used to check for meniscus pathology. To check medial meniscus, and lateral meniscus, the anterior drawer test is used to check for ACL incompetency. The slump test, a neurotension test. First, I'm going to have the patient put her arms behind her back, clasp them together, and I'm going to ask her to slump in her seat or slouch, and I'm going to have her put her chin to her chest, neck flexion. I'm going to put overpressure on her neck and upper spine. I'm going to slowly raise her into extension, and then I'm going to apply some overpressure with dorsiflexion. To sensitize, I'm going to have her lift her head up and ask her how she's feeling and perform the test on her other side. The test item cluster for identification of hip osteoarthritis includes patient reports that squats aggravate hip, active hip flexion causes pain in the lateral hip, active hip extension causes hip pain, patient's passive hip internal rotation is less than or equal to 25 degrees, and there is groin or lateral pain with the Scour's test in adduction. Now I'll demonstrate. I'm going to check your motion first and add resistance and adduction and an abduction. The Faber test is used to check for hip or sacroiliac joint pathologies. The anterior drawer test of the ankle tests for the anterior talofibular ligament integrity. Differential diagnosis of gluteal and hamstring weakness versus L5-S1 radiculopathy. Gluteal and hamstring weakness may present as isolated weakness in hip extension, hip abduction, and hip external rotation. They may also have isolated knee flexion weakness, a positive Trendelenburg sign, which Taylor is going to show us. Notice she's dropping her hip. Normal reflexes and sensation, hip active range of motion deficits due to weakness, but full passive range of motion. L5-S1 radiculopathy may present with radiating pain into the lower extremities, sensation deficits in the L5-S1 dermatome, myotomal weakness in ankle plantar flexors, knee flexors, and great toe extensor, diminished or absent Achilles tendon reflex, a positive straight leg raise, and a positive well leg test, which I'll demonstrate now. Going to passively raise her leg. If she has symptoms in this leg, it is a positive straight leg raise. If she has positive pain in her other leg, it's a positive well leg test. She would also have a positive slump test, which we demonstrated earlier, and she would have abnormal imaging, maybe showing a herniated disc.